Hello everyone, I'm very happy to be talking to you today through this new video clip. You, the healthcare professional, know better than anyone the health network is continually failing. Every day, the media highlights the lack of family physicians, the long waiting times in the emergency, or the feeble care given to seniors. Every day, you can see the aberrations in the healthcare system, and most of the time, you are the first one to suffer the consequences. Despite this, you push yourself to the limit in order to be able to give quality care to the people of Quebec. In light of these same problems that have gone on for a long time, the facts are clear. We can no longer wait for the administrators in the network in the hopes of seeing things change. And the accounting vision that has been instilled over the last few years leaves us with even less hope of seeing a real change come to be. Consequently, we cannot let those who promote privatizations of the healthcare system remain alone on this public stage. It is time to offer an alternative to their solutions that are clearly not enough and that even compromise the safety and quality of the care. Our public healthcare system isn't perfect, but there are solutions. And if these solutions come from us, the healthcare professionals, many others in the sector give their opinions on the subject, suggesting various miracle cures. But the bottom line is that, are not the healthcare professionals the ones closest to the patients and who know their needs the best? It is high time that we take the lead and be front and center. The time has come to speak out and propose new models for the delivery of care that will better meet the needs of the population and also our own needs as healthcare professionals. Since the Federation's last convention, considerable efforts have been made in order to develop alternatives to the recurrent problems in the network. And for the FIC, no one doubts that these alternatives depend on the know-how of the nurses, licensed practical nurses, respiratory therapists, and perfusionists. The healthcare system needs to focus more on the expertise and experience of its healthcare professionals by letting them completely fulfill their role and by improving their contribution. Why, for example, is the dispensary model reserved exclusively for the far north in Quebec? Why can't we also apply this model in the urban settings? The contribution of the healthcare professionals, supplemented by that of the nutritionists, occupational therapists, or social workers, will be invaluable for the development of effective frontline care. That is one of the examples of the proposal that the Federation intends to make the decision makers and the people of Quebec always with the goal of better meeting the needs of the patients. New ways of delivering and humanizing care by focusing more on services that are well established in the community. Our next Federal Council will be the time for the Federation to discuss the issue of these new models with your union representatives. I ask you to keep an eye open over the coming weeks because your support will be critical. As healthcare professionals, we must continue the fight in order to ensure the sustainability of the public healthcare system. The challenge may seem enormous, but it is far from being insurmountable. The right person in the right place would be a good start. But it is the assurance that every professional will have the means allowing her to fully perform her role while respecting the skills and expertise of everyone that will make a real difference in the living and working conditions. And if to this is added a true humanization of the care delivered to the community, I sincerely believe that a giant step forward will have been taken, and this for the greater good of the Quebec population, but also for the healthcare professionals. Think about it. We will have the chance to talk again. Thank you, and talk to you soon.